Good morning, Dr. Kiltz.
Well, Lisa, how are you doing today?
I'm great. How are you?
Spectacular. Another beautiful day in the universe.
It really is.
Many challenges for everyone.
Absolutely.
But that's the nature of life, and we got to go and move forward with a positive attitude and passion and compassion.
Absolutely. Taking that next step is always the most challenging one, but that's what gets you moving forward.
Well, we're talking about loss, and I was just talking to a patient who had a recent miscarriage, and the emotional challenges of all of that. And losing an early pregnancy or a later pregnancy is very, very difficult in life. And how do we get through that?
Really, it's talking about it. I think most of the challenges we face, and we were talking about this more because October is National Infant and Pregnancy Loss Awareness Month, and of course that's something that we hold very close to our hearts for our clients. But really, early pregnancy, and especially chemical pregnancies, pregnancies that are lost 7, 8, 9 weeks, most women haven't told their friends, extended family members, co-workers, and so it's a silent grief, it's a silent burden. And even if you were to share with your best friend, it doesn't always come up easily in conversation. You don't always want to start a conversation with, well, I just miscarried yesterday. So women are, and men are experiencing these grief episodes in silence and this heavy burden until they start sharing. And then once you tell one person that you're close with, or maybe 2 or 3 people, then suddenly you hear, oh, I had a miscarriage 10 years ago. Or my sister had 3 and then she conceived. And these stories start coming out because it is so common. And women don't realize that. When you're experiencing the miscarriage, you feel like you're the only person in the world who has lost a child. And no one is there to talk to you about it. But then you realize most women have.
And it's a common occurrence.
Yes.
Yet when it happens to you personally, it can be so devastating.
Absolutely.
And as humans, sharing our feelings with others is healing.
Yes.
And at CMI Fertility and our healing arts, we're really about how to bring people together and share the story and talk about it.
Absolutely.
And by doing that, it heals, it changes that energy, helps you to continue to work on a positive attitude and be persistent. And because you got to keep at it in order to get that which you desire and dream about. And sometimes there are some things that also need to be looked at more carefully. Some genetic testing or anatomic testing or immunologic testing. And one of the areas that I think is also important is pelvic endometriosis, which may be a silent cause of infertility and a miscarriage, biochemical pregnancy. So just some things to talk about with, first, support, and then seek advice from experts or those have some experience in this area, which I think is very, very important.
Absolutely. Well, next week in our Syracuse and our Albany locations, we'll be having our Circle of Hope support group sessions where women have an open and free and safe space to talk about losses, to share with others, and to get support from others. Our Facebook support group is very active with almost 300 clients, many of them who have experienced miscarriages and losses at all stages of pregnancy. And they're very open and supportive, and it's a place to just connect with someone else who knows what you're feeling. I also highly recommend yoga for fertility, acupuncture, or massage because sometimes you just need a quiet space to be alone. Counseling is fantastic, support groups are fantastic, but it's also good to be alone. And when you are experiencing that physical relaxation, you can also get the wonderful emotional release. And it's a really healing experience.
Well, the key is to share the story.
Yes.
And by doing that, it opens up and it starts the first step to that healing and getting the success that you desire.
Absolutely, absolutely. So if you have any questions, please don't hesitate to contact myself or our office. We can talk about both your support opportunities available and taking that next step. Maybe before your next cycle, we can take a look at any of the testing we need to do and maybe change your next cycle if necessary.
And we do offer free telephone conversations and
Absolutely.
consultations for people around the world.
Absolutely.
And in Syracuse and Albany offices, we see people from around this world, and I'm always amazed at how we're helping people to conceive and to find that success when success has been so challenging.
Yes.
And many are saying it can't happen or won't happen, but I believe that everything is possible,
Absolutely.
and we're here to help.
Great. Well,
All
thank
right.
you very much for sharing with
Well,
us, Dr.
God bless, Lisa, and thank you very much, and God bless to everyone.